A question I get asked a lot is how will the course improve my aesthetic dentistry standards? Essentially, when I set up the course, it was specifically kind of titled Restorative and Aesthetic Dentistry, because when I first set up the course, there was nothing around that really addressed both issues. They're very much restorative courses or aesthetic courses. And so I felt that because aesthetic dentistry or cosmetic dentistry has become so much in demand, that I just wanted to have a course that really combined the two. So really, yes, it will improve your aesthetic dentistry, because we go all the way through practical exercises on smile design. So you can start with the fundamentals of smile design. We go through patient questionnaires and patient communication. So not only can you spot the aesthetic concerns that the patient has, you can see if it's realistic to treat them, how picky they are they body dysmorphic, and you can really pinpoint what they want from the aesthetic dentistry. The second part of it is the clinical skills to be able to deliver that aesthetic dentistry. So, you know, we are streets ahead of other courses in terms of the composite work that we undertake, which is, you know, revolutionary. So you'll have the skills to do it with composite. We look in great detail at ceramics, zirconia, emax, which I use routinely. So you'll be able to use these materials to deliver, you know, really high aesthetic dentistry. Finally, don't forget, because the course is truly comprehensive, we cover the perio aspects. We cover the fundamentals of getting the perio stable. We cover surgical crown lengthening, the biologic width, all of these techniques, like ovate pontic techniques that you need. And then finally, you know, we go back to risk-based diagnosis and treatment planning, which is essential. And also occlusal diagnosis, so that you're only undertaking this kind of dentistry when the occlusion is satisfactory, and not undertaking it where the occlusion isn't satisfactory or there's occlusal risk factors. Then finally, because I work in a multidisciplinary kind of fashion, we look at the interface with GDP ortho and the interface with more comprehensive ortho. So you just can't look at, you know, what worries me is people do an MSc in aesthetic dentistry, and it is just aesthetic dentistry. They're not focusing on the perio and how that links with it, and say the occlusion and how that links with it. So really what we do is, yes, we have this big focus throughout the course on aesthetic dentistry, but all of these other factors are equally important in delivering high quality care, you know, that's going to satisfy your patients, but it's also going to be lasting as well. And you can deliver it in the most minimally invasive fashion as well. So I hope that helps with that question.